My name is Matrice, and today I will be giving an enema. Before entering the patient's room, I want to check the doctor's orders. I'm going to check for any fecal infectation, and that's going to let me know what type of enema to use. I'm also going to check for consent because it is an invasive procedure. I am going to check for lab results. I need to know the electrolyte, creatinine, and the blood urine nitrogen levels. I also need to check if the patient has had any history of intracranial pressure, glaucoma, rectal or prostate surgery. In this case, my patient is a female, so she doesn't have a prostate, so I wouldn't check for that. I am going to gather all of my materials. Once I have my materials gathered, I would enter the room. For purposes of the video, the materials are already inside of the room. So I'm going to check for precautions. There are no precautions today. I'll wash my hands. I'm going to knock and announce myself before entering the room. Nursing. Hi, my name is Matrice. I'll be your nurse today. You are?
Sophia.
Sophia. Very nice to meet you, Sophia. I'm going to verify Sophia's name and one other identifier against the medical chart. And I'm also going to check Sophia for any allergies. Sophia seems to have no allergies. I'm going to explain the procedure to Sophia. While I'm doing that, I'm going to raise the bed to a comfortable working position so I can maintain good body mechanics. So, Sophia, we're going to be giving you an enema today. It seems like you've had some issues having a bowel movement. Sophia, can you tell me the last time you had a bowel movement?
About 3 months ago.
Okay. And how regularly do you usually have bowel movements?
At least 5 times a day.
Okay. So, that seems to be an issue, but we're going to get that fixed for you. I'm also going to physically assess Sophia. I want to palpate for any abdominal distension. I also want to auscultate for bowel sounds. Once I've done that, I'm going to cover Sophia again. I'm going to assess Sophia's mobility. So, Sophia, I'm going to need you to turn on your right side. Do you think you're going to be able to do that for me?
With a little help.
Okay. So, I'm going to assist Sophia in turning. Well, we're not going to turn right now. First, I'm going to wash my hands and glove. So, wash my hands again. I want to put on gloves. So Sophia, what we're going to do is, on the count of 3, I need you to lift yourself as much as you can towards your right side, and I'm going to help from the other side. So I can work. My side rail will be down, but the opposite side rail will be up. So on 3, Sophia, we're going to roll. 1, 2, 3. And I will instruct Sophia that she can hold on to that side rail for comfort. Once I have Sophia turned to Sim's position, I'm going to prepare the enema. I'm also going to check Sophia's level of sphincter control. I'm going to place this protective sheet under Sophia. I'm also going to place the bedpan there because Sophia expressed to me she has some limited mobility, so we're not going to get her out of the bed. I want to pour in the soap concentrate. I also want to pour in warm water and get that all mixed up. I'm going to press that together. Before pouring in the concentrate, I would have clamped the enema to make sure that none of it runs down. So get that clamp, get the concentrate the mixture together. Because it's clamped, I'm going to go ahead and hang the enema. I'm going to remove the cap and I'm going to generously lubricate the enema. Once it's lubricated, I'm going to gently insert the enema. Once I have it inserted, I'm going to take the bag, put it at hip level, and remove the clamp. As the enema starts to flow, I'm going to see Sophia's tolerance for the enema. I'm going to gradually raise the bag 12 to 18 inches, as long as Sophia tolerates that pretty well. I'm going to hang the bag, and I'm going to instruct Sophia to retain the fluid for 5 to 15 minutes as tolerated. So after all the fluid has emptied and Sophia has had a bowel movement, well, before that, actually, I would return Sophia to a squatting or a sitting position, just something to promote defecation. So once Sophia has defecated, I want to remove the bedpan, and I'm going to look at the characteristics of the stool, the amount of return. I also want to note the color of the solution and the color of the stool. I'm going to remove this enema and dispose of it. I'm going to get Sophia all cleaned up. Once she's all cleaned up, Sophia, we can turn you back over. I'm going to de-glove because these gloves are nasty. I'm going to wash my hands. We're going to get Sophia back into a comfortable position. Sophia, you want to turn back over? And we're going to do some patient teaching. I'm just going to let Sophia know that relying on enemas will actually interrupt the normal process of defecation for her. So I'm going to encourage her to alter her lifestyle and eating habits. And some ways to do that: she can increase her fluid intake, increase her fiber, or she can increase her exercise. After I've done the patient teaching, I want to lower the bed all the way down. I want to raise the side rails, give Sophia the call light, check for any pain. So I'm going to assess any discomfort. And Sophia, are you in any pain? Sophia, are you in any pain? Sophia, are you in any pain?
No pain at all.
Okay, so since Sophia's in no pain, we want to wash our hands again before leaving the room. And once I document, I just want to make sure to document Sophia's tolerance of the procedure. I want to document the amount of solution used and also the amount of return, the color of the return, the amount and characteristics of the stool, and the color